Hi everyone, my name is Ashley Miller and I'm presenting my poster presentation. The title of my DNP project is Developing LGBT Competencies in an RN Residency Program. I'll begin by discussing the introduction section, which is located on the left side of the poster. In the United States, an estimated 3.5% of the population identifies as lesbian, gay, or bisexual, or approximately 9 million Americans. There are 1.4 million Americans that identify as transgender. The lesbian, gay, bisexual, and transgender LGBT population experience stigma and discrimination from a lack of awareness of health needs by health professionals. This results in this population facing challenges when accessing culturally competent health services. The disparities that this population faces results from a lack of culturally competent healthcare. Most healthcare professionals have good intentions when caring for LGBT clients, but they lack knowledge and ways to communicate their acceptance of LGBT clients. The LGBT population faces many different health disparities. LGBT youth are more likely to commit suicide, and the elderly suffer from isolation and lack of social services. In lesbian, gay, and bisexual youth, suicide attempts are 4 times greater than heterosexual youth. Transgender individuals have a higher risk for victimization as well as mental health issues. Each episode of victimization, whether physical or verbal harassment, results in the likelihood of self-harm behavior increasing 2.5 times on average. Furthermore, there has been a long history of anti-LGBT attitudes in the healthcare setting, which shapes the health-seeking behaviors of and access to care for LGBT individuals. Additionally, bisexuals have difficulty with access to care, and LGBT individuals were less likely to get coverage through their employer when compared to the general population. The historic and sexual stigmas influence LGBT health that results in negative outcomes. Negative outcomes include increased rates of suicide, elevated levels of violence, increased mood and anxiety disorders, increased risk for obesity, increased rate of sexually transmitted diseases, and increased risk for homelessness. This social stigma places this population at an elevated risk for mental health problems and substance abuse. With the lack of cultural competence among healthcare professionals such as nurses, they will be less likely to address the negative health outcomes faced by the LGBT population. The lesbian, gay, and bisexual population also have more asthma diagnoses, headaches, allergies, osteoarthritis, and gastrointestinal problems. Lesbian and bisexual women report higher rates of asthma, urinary tract infections, and hepatitis B and C when compared to heterosexual women. Additionally, gay and bisexual men report more cancer diagnoses, lower survival rates, and urinary incontinence when compared to heterosexual males. It was found that 80% of nurses lacked education or training related to LGBT issues, and healthcare professionals received little cultural competency training and continuing education as it pertains to this population. When healthcare providers lack the knowledge to care for a patient population, they may display negative attitudes such as discrimination and denial of care. It was found in the transgender community that 39% of people faced harassment or violence in the healthcare setting by healthcare providers. This fear of discrimination leads some individuals to avoid seeking any healthcare. Furthermore, the inclusion of LGBT health topics in nursing curricula do not adequately address the multifaceted health needs found in this population, and this content is limited in nursing curricula. The purpose of this DNP project is to develop, implement, and evaluate the impact of an LGBT education program on nurses' knowledge and cultural competency in order to build competence in providing culturally competent care to the LGBT population. I have two objectives for this project, and they include developing an evidence-based LGBT educational program for inclusion in the nurse residency program, and assessing the nurse residents' knowledge and cultural competency about healthcare needs before and after the educational intervention. My project question is, will an LGBT educational intervention improve the knowledge and cultural competency of newly hired RNs in the nurse residency program? I will now move on to the methods section, which is found in the middle of the poster. This project was a quality improvement project design that included a one-group pre-test/post-test quasi-experimental design. The project was guided by two conceptual frameworks: the process of cultural competence and the delivery of healthcare services model guided the LGBT educational intervention. This model was developed by Dr. Josefa Campina-Bocotti. This model describes cultural competence as the ongoing process where the healthcare provider strives to achieve the ability to work within the cultural context of the client and includes the individual, family, and community. Cultural competence is essential in providing both effective and culturally responsive care to everyone. There are 5 major constructs of this model and include cultural awareness, cultural knowledge, cultural skill, cultural encounters, and cultural desire. Cultural awareness is exploring one's cultural and professional background. Cultural knowledge refers to obtaining an educational foundation that deals with diverse cultural and ethnic groups. Cultural skill is the ability to collect cultural data from the client and being able to perform a culturally competent physical assessment. Cultural encounters refer to the process that encourages healthcare providers to engage in interactions with clients from diverse backgrounds. Last, cultural desire is the process of the healthcare provider wanting to be culturally aware, culturally knowledgeable, culturally skillful, and familiar with cultural encounters. This model guided the educational intervention and allowed the nurse residents the opportunity to gain appropriate knowledge and skills necessary to care for the LGBT individual. This knowledge will allow the nurse resident to continuously work towards providing culturally competent care. I was unable to place a figure of this model due to copyright reasons. Next, the model for evidence-based practice change was developed by June Larrabee, and this was used as the change management foundation for the project. This model is used to emphasize change using evidence-based practice. If you look at figure 1, you can see the 6 steps to this model. The first step is assessing the need for change in practice. This is where I completed a needs assessment, included key stakeholders, and developed my PICO question. The second step is locating the best evidence, and this is where I identified the types and sources of research, planned the search, and finally carried out the search. The third step is where I critically analyzed the best evidence found. The fourth step is designing the practice change, and this is where I created the educational program. The fifth step is implementation, and I was able to implement this project to 40 participants. This step also includes evaluation, which is currently taking place. The final step is integrating this change into practice. This project took place in a medical center located in northeastern United States, and the population of interest was nurse residents. Inclusion criteria included employment as an RN in the health system and membership in the current nurse residency cohort. Prior to implementation, I attended the nurse residency sessions in August 2017 to recruit potential participants. I attended the sessions and explained my project, handed out information sheets explaining my project, and I also answered questions that the potential participants had. The potential participants were informed that this project is taking place as part of a doctoral program and benefits of the project were described. Benefits include increased LGBT knowledge and cultural competency. They were told that the sessions would take place during the month of September during their regularly scheduled nurse residency classes. I worked directly with the nurse residency program coordinator to set up times to meet with the nurse residents. During the next month, September 2017, I implemented my project to one group of nurse residents that took place in 3 sessions. 30 participants were my original goal, and 40 participants took place in my program. The program began by participants filling out the demographic questionnaire, the inventory for assessing the process of cultural competence among healthcare professionals revised IAPCC-R tool, and the nursing students' knowledge and attitudes of LGBT healthcare concerns NKALH survey. Participants were asked to come up with a unique number that was the same to place on both the pre-test and the post-test. They were informed that the results were confidential and cannot be linked to them. The demographic questionnaire asked questions on age, gender, race, LGBT education, and LGBT status. There was also a question that asked if they had cared for an LGBT patient in the past. The IAPCC-R tool is used to measure the level of cultural competence among healthcare professionals. The tool consisted of 25 items that measure the 5 cultural constructs of desire, awareness, knowledge, skill, and encounters. The NKLH survey consisted of 10 questions that assessed LGBT knowledge. Permission was granted to use both tools in this project. After the pre-test materials were completed, the LGBT program took place, which consisted of an interactive PowerPoint presentation, a video clip embedded in the presentation, and group activities that included real-life case scenarios. Program content was developed based on information from the Institute of Medicine's IOM report on the health of lesbian, gay, bisexual, and transgender people, building a foundation for better understanding, and the National LGBT Health Education Center, a program of the Fenway Institute. The information described in the IOM report was used as a content for the educational program. For example, the IOM report discussed basic terminology related to this population, stigma as well as access to care issues, and various disparities felt by different age groups. Content of my program included LGBT terminology, concepts of stigma and discrimination, health disparities, myths and facts on sexuality and gender identity, and overcoming barriers to provide culturally competent care. The education program was framed based on the 5 constructs of Dr. Bacote's process of cultural competence and delivery of healthcare services model. Post-implementation of the educational program, the participants completed the post-test, which included a program evaluation survey, the IAPCC-R tool, and the NKALH survey. Currently, data is being analyzed and results will be available by December 1st, 2017. The results of this program will be used to continually develop and enhance the program. Furthermore, the goal is to implement this program beyond the nurse residency program to improve LGBT knowledge and cultural competency. References can be found on the bottom right-hand side of the poster. Thank you for listening to my presentation. I appreciate feedback and I will answer any questions that you have. Thank you.